Hey everybody, thank you for joining us. We'll just wait for 2 or 3 minutes so we can receive everyone who's entering, and then we'll get started. I think we already have 18 people. I think we can just get started, and we'll start a bit slow with some time for you to present yourselves before the presentations initiate. Today is March 31st, and this meeting of the Alive Learning Forum is about living evidence guidelines. So we're going to speak a little bit about challenges and opportunities in using evidence outputs for recommendations that are always up to date. So our first request is that you can tell us a little bit about yourself. So if you scan this QR code with your cell phone, you should be taken to a few questions we've prepared just to get to know you a little bit better. So I'm going to request that each of you, we're in about 20 people right now. So if you could, at this moment, scan the QR code. If for some reason you don't have a cell phone with you, you can also type in menti.com and then followed by the code 13369804, and you'll be taken to the same questions. So we'll just leave this screen here a bit so that we can all log into this. And Christian, you could tell me if this is working out. So I guess you'll be able to see
It is.
if,
Some
yeah,
people
great.
found it.
Okay, great. That's great then. Let's just give them some time. And then Christian, whenever you want to share the screen, you can warn me. Hey, everybody who's just arriving. I see we have some people still entering. Uh, we're just giving some time to present ourselves. You can scan this QR code and you'll be led to some questions that we've made just to get to know you a bit better. For those of you who are joining us for the first time, the Alive Learning Forum is a network. It's an open network. Anyone can participate. Our objectives here are to disseminate what's new in living evidence and sharing good practices, lessons that we're learning. And this is quite an emerging field. So it's really about sharing practices that we have around the world. We have a few co-chairs, each from a different region. And we have monthly meetings. Just checking here. How are we going, Christian? Do we have a relatively nice response rate? Can we get started? Should we wait a bit more?
Yeah, I think we're good. Yeah. We have 6, 7, 8, 9, or like around 10 to 15. Oh, yeah, 9 out of 10. Yeah. So I think
Okay.
9 out of 10 are people that have joined. So I think they're good.
Is anyone, so this is something we're testing out for the first time. We're trying to make this meeting a bit more interactive, and we're really excited to get to know you a bit better, know what motivates you to join us today. So this would be, we're testing this out. If anyone is having any difficulty logging in to Mentimeter, just give us a heads up in the chat here, and we will try to help you as best we can.
I put the link for this survey on this.
Oh, that's great. Thank you, Christian. Let's give it one more minute. What do you think, Christian? And then we get started just for the sake of time.
That's good. Just let me know. You can share back your screen whenever you want, right? Okay?
So I should actually stop sharing so you can share, right?
No, no, I'm just sharing. I'm sharing right
Okay.
now.
Well, that okay. Sorry, I wasn't seeing that. Great. So our first question here was what is our first question? What makes a strong guideline? So today, as we've introduced already, we're going to be talking about guidelines, and our curiosity was to know a bit of what kind of experience you've had previously with guidelines. Here we have a few answers. We already have 16 people of the 28 logged in, which means some of you weren't able yet to access the Mentimeter, so there's still some time. It's not obligated either, so just start reading, sharing some of these responses here. A strong guideline is trustworthy. It's informed by good evidence. It's systematic. It's transparent. It's uh, easy to use. We have a second uh, word of clarity here. We believe strong guidelines follow the grade the grade. Well, grade in itself is a guideline, right? It's up to date. There's a lot to do with why we're speaking here about living evidence. It has the ability to positively impact people's lives. It has strong methods, um, economic evidence. It's trustworthy. Nice. It follows a rigorous approach. It seems like we have lots of process geeks among us. Certainly one of them. Value good methods. Great. Thank you, Christian. I'm just checking here at the time. I thought we had different questions. Didn't we ask them about the geography and about previous experience with guidelines?
I think you did. Like you maybe were not like watching at the screen, but I think that I was just like, projecting those at the beginning.
Ah, okay. Sorry, I think I
Yeah.
missed those two slides then. Okay. Let's just, we should maybe just continue then. So let me present my screen once more. Just give me 1 minute. I'm sorry, my computer seems to have frozen.
I can share it if you want.
Could you
Just to be
share it,
sure.
Christian? Yeah,
Yeah, I'm sharing right now.
okay.
Can you see my screen, Brett?
That's it. Yeah, great. Okay, so that's me. I'm sorry for the delay. Computer had a little bit of a meltdown here. So I'm the host for today. I'm speaking from São Paulo, Brazil. I'm a researcher at INSPIR, a higher education institute here in Brazil. I have a master's degree in public policy management. I'm actually a PhD candidate in the same line of studies. My line of work is a bit in monitoring, evaluation, and learning. I've worked a bit with the United Nations system and also in the interface with public policy here in Brazilian government. And in my free time, I'm really interested in closing the gap between evidence and policy through networks such as the Alive Learning Forum and previously in the Brazilian Coalition for Evidence and the Evidence Hub for Latin America and the Caribbean. Thank you, Christian. Okay, this is our agenda. We've just presented, I've just presented myself, and we will now start the presentations. So we have today with us Olivia Urquhart and Tamara Lotfi, and we'll have two presentations for 10 minutes each. We'll have some time for a panel discussion and a Q&A before we close today's session. So just a few good practices. We ask you to keep microphones off uh, until invited to unmute. This session is being recorded and it will be shared online. You've been added to our mailing list for future events, and you can unsubscribe from that list at any time you wish. If you have any questions, you can just write to us at coordinator@aliveevidence.org. Yeah, you can pass the slide now, Christian. So today's session aims to talk a little bit about developing how it is to develop and maintain living guidelines. We're going to talk a little bit about methodological and the resource challenges in this process, how partnership models can work, and equity considerations, and speaking a little bit about how we can move evidence outputs to up-to-date recommendations. Great. So let's present our panelists. I have a short biography here, and let's start here with Olivia. Olivia is Associate Director for Healthcare Guidelines and an instructor at the Center for Integrative Global Oral Health at the University of Pennsylvania School of Dental Medicine. In this role, she leads the development of oral health living guidelines in collaboration with the American Dental Association. So prior to joining Penn Dental Medicine in September 2022, she served as a lead data analyst and clinical practice guideline methodologist in the Department of Evidence Synthesis and Translation Research at the ADA's Science Camp Research Institute for 6 years. And we have Tamara with us, and she's a guideline methodologist and a senior evaluation specialist at the International Initiative for Impact Evaluation, also known as 3IE, where she provides technical leadership on evidence synthesis products across sectors and thematic areas and drives opportunities for contextualization. So her work is focused on producing rigorous and policy relevant systematic reviews and impact evaluations, alongside advancing approaches to living evidence and knowledge translation to enhance the accessibility and usability of evidence for decision making. So thank you very much, Olivia and Tamara, to be with us today. We will now give you the opportunity to share your own slides. Olivia, let's start with you, please, if that's okay. So you have 10 minutes.
Thank you, Fred. Okay. Yeah, so I'm Olivia Urquhart. Today I'm going to be talking about the transformative role of living evidence-informed guidelines, specifically in oral health. Before I start, I just want to point out that all the work you'll see here in this short presentation is supported by all the beautiful people you see here, beautiful, smart people you see here. We couldn't do this without all of them. So I'm just one person presenting on behalf of all these individuals and organizations. Oh, sorry. So I just want to start at a high level here. It seems like most people on this call, based off of the poll, know what a guideline is, but just in case we have some people who are new to the field, I wanted to just start with a definition here. So practice guidelines are statements that include recommendations intended to optimize patient care. They're informed by systematic review of evidence and an assessment of the benefits and harms of alternative care options. And this comes from the National Institute of Medicine's definition. So here's a kind of a depiction of what the guideline development process looks like. At a from a big picture perspective, we have a guideline panel that you see here on the right. These are these individuals, and they come up with questions that they would like to be answered by a guideline. And all the behind the scenes work is all the work you see here on the left-hand side of this figure in the systematic review evidence synthesis process, in which we have people, methodologists, systematic reviewers developing systematic reviews of the evidence. In our case, when we do living guidelines, it's living evidence to support the development of guidelines. So what are the issues here? What are the problems that we have with this framework? Problem one, the guidelines that we develop become quickly outdated as new evidence emerges. As you can imagine, scientific evidence has rapidly develops, and we can't keep up with it when we develop guidelines at the traditional way that we're all used to seeing them being developed. Problem two, systematic reviews are resource intensive. They're the most expensive, most time consuming part of the guideline development process. So how do we optimize the development of systematic reviews to support these guidelines? So one solution, the solution I'll be talking about today, is living guidelines. So this figure here is a depiction from a paper from GCE, but essentially what you can see here on the left-hand side of this slide is the classic method for guideline development. So we have a whole host of recommendations. You can see here depicted by the horizontal lines in a guideline. And over time, each of these recommendations become outdated at a different pace, right? We may have new evidence that for one recommendation that comes in just a few months after we publish a guideline, another recommendation we might not have evidence for years and years and years. So as you can imagine, within one guideline, the different pieces of that guideline, different recommendations, become outdated at different times. So what can we do about that? Well, we could decide to update a guideline very frequently. We can update a guideline every year, every 2 years. This is with this approach, as you can see here depicted in this figure, with this sort of dashed line, yeah, we have a very up-to-date guideline, but it's not very efficient, right? The other approach we could take is we could just wait until all of the recommendations become outdated and update the guideline at a kind of a fixed interval, say every 5 years. And this is a very efficient approach, but it's low validity, right? We have recommendations that are becoming outdated perhaps years before the new guideline even is published. So what we do here at the University of Pennsylvania is we are conducting living guidelines, where we are moving from thinking about guidelines as or updating a guideline itself as like the big overarching like document or topic to updating individual recommendations within that guideline. So for those of you who don't know what a living guideline is, a living guideline is a clinical practice guideline that is continually updated, identifying new evidence as soon as it becomes available, and appraising, synthesizing, and incorporating it into living recommendations. So if we think about, the old way or that the guidelines were produced, we can think about it as a map. It's a static document, usually published in a journal article. What we're moving towards are living guidelines that can be kind of analogous to more of like a GPS system, right? On your phone when you're driving your car. Dynamic, digital, can be updated frequently, and that information be available as soon as possible. So you can see this figure here on the left-hand side. We made sort of an analogy here about, I said a living guideline could be compared to our GPS navigation. So when you want to put the directions into your phone to get somewhere, you put in the initial address, right? That's like the initial recommendation in a guideline. As soon as new traffic information becomes available, there's an accident. This is akin to having new clinical or public health evidence emerge. Your GPS will recalculate the route in a living guideline. The recommendation will be revised, revisited, and this will happen on a continuous basis, right? Your GPS will navigate you around that accident in a different direction, but if, say, another accident comes up or another or a construction or whatever, it'll reroute you again. So that's the idea of a living guideline. We're continuously looking for new evidence and continuously updating recommendations as this evidence emerges. So how do we keep up with the evidence base and incorporate it into guidelines in a timely manner? So this, of course, is we're here talking about living evidence. So this is the sort of process we use at the University of Pennsylvania in collaboration with the American Dental Association to monitor the evidence as it emerges. So this is, those of you who are familiar with the traditional systematic review process that's depicted here on the slide, but I want to point out these logos here on the right-hand side, because this is really how we make our processes efficient and automate some of our processes with, of course, humans in the loop within these processes. So we're constantly making sure that we are the information that we are synthesizing and how we're monitoring the evidence is valid. So you can see here we partner with Epistemonicos, and they have to both conduct searches, to both develop search strategies, conduct the searches, and screen the retrieved titles abstracts that we get from our systematic reviews. And they have a fantastic platform called Sustainable Knowledge Platform that has some AI components within it. And if anyone has questions later, we can talk more about it. And that helps us really optimize the process of monitoring the evidence. And then I also want to point out here below that our team at the University of Pennsylvania is developing an AI-driven data extraction tool to help with I would say semi-automation of data extraction for systematic reviews, of course, with humans in the loop. So I mentioned that the sustainable knowledge from the Epistemonicos team helps us. They help with title abstract screening and sifting through the evidence, and they have these things called AI classifiers to help with that process. Again, I'm not going to go into too much detail here, but that is part of how we are able to keep everything so up to date and efficiently. And then I also want to talk about some of the digital platforms and tools that we use to actually host the living guidelines. And this enables us to dynamically update recommendations as the evidence emerges and impacts those initial recommendations that the guideline panels develop. We work with Magic App. Magic App is a digital platform. It's multi-layered, meaning that you can see as little information or as few information as you would like. So lots of people just want to see the recommendations. You can do that here, or you can drill down all the way down into the evidence for people that are a little more interested in that. This is just a screenshot from one of our guidelines that we just developed and released on the early detection of oral cancer. And this is some work we're proud of here. If I had time, I would do a whole demo for you, but this is an infographic that we developed with Magic App developers. This lives on the American Dental Association website, and it's supported by the Magic App platform that I just showed you through APIs. So anytime recommendations are updated, this infographic is updated. It's like the front-facing, I guess, deliverable of the guideline. Like if you want to know what to do, what the guideline says, this is where you go. So I'm really excited about this new development. And of course, with living guidelines, they're supported by living evidence syntheses. And as I mentioned before, we work with Epistemonicos, who has this other platform called Interactive Evidence Synthesis. And here we host our systematic review protocols and manuscripts here. And again, this can be dynamically updated. So here you can see a screenshot of the protocol from that platform. Here is our living evidence synthesis. And you can see here we have a section called living review updates. And you can see, when the last date of search is and kind of the status of this review in real time. We still produce traditional journal articles. And last, I would like to speak a little bit about some of the challenges we've had in doing this. We're a new program. We've been only doing this for about a year, although our team is very well versed in traditional guidelines. But in this living guideline world, we have run into some challenges, and one of them being peer review timelines. Like I mentioned before, we still publish all the guidelines in peer-reviewed articles, journals, which is great because they're still rigorous. They're still being evaluated by peer review. But as you all know, in this world we live in today, those timelines can be variable. We don't know when we're gonna get the peer reviews back. And we have deliverables that we plan to produce on a quarterly basis. So knowing it's not very conducive to the traditional peer review process. And of course, if there are updates to recommendations, we can't wait months and months and months for them to go through peer review. So this is a challenge. Living guideline panels. We have lots of fantastic experts in the field, right, as part of our guideline panels. But the reality is that we need them to be available to update recommendations and review the evidence on a continuous basis. And it's just difficult logistically to get them all together. Versioning and citation of updates. We haven't had an update yet because we're new, as I just mentioned, but we're planning for it, and we've had many discussions about how we're going to version our documents, and are we going to have new DOIs when we have a new update to the guidelines. So these are all in the traditional academic scholarly way of doing things. This wouldn't be an issue, but now we have constant updates and we need to keep track of those with the journals. Scoping projects. I think we can't ignore project management aspect of developing guidelines or developing, living evidence syntheses in general. There's a lot of moving pieces. So just making sure that we are, delivering things on a kind of we're, like I mentioned before, we're trying to deliver things on a quarterly basis. So there's some sort of expectation from our audiences that something's going to come out from us on that sort of time frame. So we need to make sure that our projects don't go too large to accommodate that. And then the last challenge, we haven't run into this yet, but again, we're planning for it. Okay, what happens if a recommendation changes? How do we communicate that? We need to work with implementation scientists to make sure that any updates to recommendations that maybe change the direction of a recommendation are now communicated to the end users. And I have 2 more slides here. Enablers in developing living guidelines. You can't do anything without a fun, kind, supportive team. If it's not, this work is very fast-paced and challenging. So if you don't have some fun behind it, I don't think it's doable or worthwhile endeavor. dynamic living digital platforms, like I mentioned, Magic App, Epistemonicos, they have these platforms that enable us to really work efficiently and fast. And then, of course, we're in the age of artificial intelligence supported tools. So all these things help us, maintain our efficiency. And I cannot speak about this without mentioning our partnerships with the American Dental Association, who fund the work we do. We develop the guidelines for them, and it really is a two-way street in terms of feedback and constant communication to make sure it's the best deliverable for the end users. And I mentioned Epistemonicos, Magic App, and our internal teams at UPenn. And looking forward, our team plans to develop this automated data extraction tool. Like I mentioned, we want to work on global adoption and adaptation of living guidelines, and we want to integrate our living guidelines into electronic health records. Thank you for your time. This is our team, and follow us on social media. Thank you.
Thank you, Olivia. That was great. I just want to say that if you have any questions or comments to make, you can leave them in the chat. We'll be reading them. We'll wait for the panel discussion. But in the meanwhile, it'll be great to capture those comments. Thank you once more, Olivia. Tamara, can we go to your presentation now? Do you have slides to share with us?
Yes. Hello, everyone. Can I get a confirmation? Oh, still loading.
Yeah, it seems to be working.
Is it in full mode?
Yes, it is. It's great.
Perfect. Hi, everyone. Thanks to Christian and the team at Alive and Fred for organizing, sharing, and for my colleague Olivia for setting the scene. I'm very excited to share some of the experience that I have with you. Disclaimer, I am not a living guidelines expert. I have contributed to some work, and I'm very excited to share what I've contributed to and what I've learned, but also learned from you. You'll see on some of the slides, I'll ask you to share some things about your experience. So please, when you see the slide that says share your opinion, please do drop your answer in the chat. So Tamara Lotfi, I'm at the 3IE, the International Initiative for Impact Evaluation. And the work I'll be presenting on today is both from 3IE, but also from a previous involvement with McMaster, Cochrane Canada, and the GRADE Working Group. And there we go. So I'll speak a bit about my experience from the COVID-19 pandemic, and then my experience with the Living Map of Recommendations, or REC map. Then we'll talk about 3IE's Development Evidence Portal. And a shout out to anyone who's on the chat, is on the webinar, who's been part of any of these projects. And I have no conflict of interest to declare, other my big interest in getting all these things big and going. So to start, just to take us all back to COVID-19, and I feel it's a good example to share because we all have at least one kind of experience with it, is to just take us back to the type of guidelines that we were seeing. And it's something that had to be done. There was an emergency. It was urgent to produce some sort of guidance or recommendations for policymakers to answer policymakers' needs. There was a pressure to all policymakers. And so I'll use the example of the World Health Organization that produced interim recommendations in the lack of enough evidence, but the strong need to have something out there. So we started seeing interim recommendations. After that, we saw full guidelines being developed. And then later on, there was a shift towards living guidelines for topics that were continuously considered as a priority. And within the document of living guidelines, we'd see sections to specifically highlight what the new recommendations are vis-a-vis prior versions. And so I've seen some names I recognize in this webinar who have vast experience with the methods for living guidelines. I will not talk about that. I know Olivia has covered some. But I'd like to get your opinion on what do you think the priority was when producing COVID-19 recommendations. And I list a few here. So was it timeliness? Was it the topic, the methods, the availability of evidence, access to data, existing recommendations? So when a group of decision makers were sitting together, what was it, in your opinion, that was driving the need for recommendations, or pushing towards getting recommendations ready. Share your answers in the chat, please. I'll give it 5 seconds before I move to my next slide, but please keep the answers coming.
Timely is 4 out of 4.
It's 4 out of 4. So let me ask you, let's say timeliness is what we're going to focus on. I see also someone adding methods. Is living really the solution for a guideline to answer the needs in a fast developing disease such as COVID-19 at the time? In your opinion, was going towards a living guideline necessary? Was it important? Was it somewhat important? And the reason why I'm asking is this is 4 or 5 years ago. Were we ready to produce living guidelines? Were our methods ready to support the urgent need? Were we trained enough in understanding the urgency, but also not compromising methods, but also were we equipped resources-wise to produce living recommendations as they came? So feel free to drop your experience in the chat. I'll move to my next slide and I'll say, my experience was we were not producing living recommendations with my group, but instead we produced a living map of recommendations for COVID-19. So this was work that was led by Holger Schoenemann, along with a large group of experts from all around the globe. I'll share some more details about who joined us, but just to tell you that we moved to something called the living map of recommendations, which was, from its name, a map that was living, continuously regulated. The purpose of it was to bring all these recommendations that were coming out at fast pace to one place so that policymakers, patients, public, healthcare workers, everyone could find them all cataloged in one place that would be accessible to everyone, organized the guidelines and recommendations in a way that is putting together outcomes, actually intervention categories and populations, linking to underlying evidence, and mainly capturing clusters so that you could immediately identify where recommendations exist and highlight the gaps to know where they're still missing gaps. So the QR code here will take you to the map directly if you scan it, and to stress on the fact that this was a freely accessible digital tool. Now the capacity we had to create such a map was built on the fact that we had a priori built a map of TB, tuberculosis recommendations for the WHO's Global TB Department. That was, let's say, our pilot. Because of that, we had an infrastructure that was ready to be mobilized for COVID-19. And as you can see, the purpose was to catalog recommendations, present them in 2 views. So map view, as I mentioned, for clusters and gaps, but the list view was important because sometimes an expert, a decision maker, healthcare worker would just want to see the list of recommendations after filtering for, let's say, the organization, whether or not it used grade, the quality, because as part of this work, we appraised the guidelines from which these recommendations were coming from. So this is where all the teams were from who joined. It was a massive work that lasted for 3 years, funded by the Canadian Institutes for Health Research. And as you can see, the process took this much capacity, took the involvement of so many people globally, and more that I might have missed including here. And just to stress that all this was necessary because we had a living search that would capture guideline documents, take them through a screening based on preset criteria, appraise them using grade 2, GREE 2, and then extract them using Grade Pro. So we had customized Grade Pro to allow extraction, and that would be the platform that would push to the rec map. And then for dissemination, we had this rec map as a tool, but also we had a whole team that was drafting. We had citizens that were editing, medical editors to produce what we called plain language recommendations at the end. And all the recommendations were linked to their underlying evidence through existing living repositories of evidence. And at the time, we worked closely with Epistemonicos using their Love platform, but also with an IPH team that had developed a living map of COVID-19 evidence that lasted from February 2020 to April 2021. And unfortunately, that map was not sustained afterwards because, as you can imagine, all these types of maps or tools require a lot of resources. But let me ask you, in your opinion, this was the process very briefly. What parts had to be living? I'll give you 5 more seconds. Okay, and I'll go with the 2 answers we've received, 3 answers we've received so far, all of them, absolutely. So because the need was continuous, because every single detail that went on this map was at any point very important, all the steps were living. So I'll quickly share the factors that supported capturing relevant recommendations for these maps to succeed. First, it was the fact that guideline developing organizations, so be it WHO, CDC, NICE, and others, they were able to access data as the data was ready and then publishing recommendations. And so then we were able to capture them, publish them on our RECMA. Journals such as JCE and others were shifted to making COVID-19 publications open access, which supported development of recommendations. And then collaborations. And this was a major success factor, in my opinion, during COVID-19 for why we as scientists and as researchers were able to respond to some of these needs from policymakers and patients and interest holders globally. And so the key milestones, in my opinion, for the work with the RECMAP was that first we were able to tailor 2 different interest holders and to note that we had done knowledge mobilization work globally with 11 groups, a lot of more details to be shared separately. We had done some testing for the usability of the tools, such as cognitive walkthroughs and others, so features, testing for content, but also linking to the evidence repositories, as I mentioned, preparing the infrastructure for other diseases. So right now there's a group at McMaster, the chronic pain group is also using this infrastructure to develop their own RECMAP, but also lots of methods work, such as diverging recommendations, types of actionable statements, and plain language recommendations. So in the chat, let me know, what other living repositories do you know of? All right, so I'll tell you, there is the Development Evidence Portal. So the Development Evidence Portal, and this is to all my healthcare and health colleagues, this is to shift us a bit, one step outside our health comfort zone. So the Development Evidence Portal is the world's largest curated repository for rigorous evidence on what works in international development. And it has more than 18,000 impact evaluations, more than 1,600 systematic reviews, focused mainly on low and middle income countries. I see the video is not loading properly, but there we go. And it feeds from monthly searches for impact evaluations, and this is work that is led by Bertus Nisvit and Mark Engelbert, Etienne Luamba, and many amazing colleagues at the 3IE. And to say that we have a chatbot that's currently being developed and tested to help users find answers from this development evidence portal. So it catalogs systematic reviews, impact evaluations, and it can be filtered using multiple features. And I'll jump to the next slide just for the sake of time, but to let you know that it catalogs all these types of evidence and the evidence gap maps that come from different places geographically, that cover different topics. So as you can see, industry, trade, education, public administration, social protection, and so many others. And I highly invite you to visit the DEP. So why am I mentioning the DEP? Because we are trying at 3IE to close this loop between living evidence, living repositories, guidelines, and so on. And we're doing that by identifying policy relevant topics. And my passion is in finding topics that jump beyond a single sector, because I know I've worked with many of you here. We all believe that it cannot be dealt with, we cannot find solutions from one place. We have to collaborate across disciplines. And so we're finding policy relevant topics, capturing low middle income country evidence from the DEP, preparing systematic reviews that immediately are built in a way that would inform guidelines, build institutional capacity for producing recommendations, and package it with a contextualization lens. And obviously, the living component will be across, depending on need and depending on criteria that have previously been established on when to conduct living guidelines. For the social media users out there, PEV or point of view. Is a guideline, in your opinion, a product or a tool? Food for thought. Thank you for the opportunity to present, and this was my set of slides. Please do reach out. We are looking to collaborate with groups who are interested in helping us develop guidelines in the international development sector. We're building capacity for that and the methods for that. So if you are interested, feel free to drop me an email. Thank you.
Thank you, Tamara. Wow, that was really good. Very inspiring. I think to hear from both of you, it's impressive to see how much we've advanced so quickly in the last months with new methods and tools. So great. Well, the next slides we have are actually just to present the fact that we're going to initiate a panel discussion. So if you do have any specific questions you'd like to ask to Tamara Lotfi, you can drop them here in the chat. I realized we did have Regina mentioning that she's been working on some living evidence infrastructure tools. Regina, feel free to open your microphone and comment if you do want to do that.
Yeah, thank you. Thank you very much. Thank you, Frederick. It's just a quick one. My name's Regina. I'm from the Institute for Development in Sierra Leone. We started in about 2022, where we started helping the Sierra Leone government because we had a lot of problems in terms of the same fractured information and policies all over the place. So we started trying to use AI to help to bring that to one platform in the first place, and then to make sure that you can be able to interrogate those policies. But in doing that work and talking to lots and lots of colleagues, we recognized that this was a challenge for a number of organizations. So what we started building was just infrastructure. So not necessarily data, but just infrastructure that anybody like a WhatWorks Hub, like a 3IE, could be able to use. And what we found interesting and useful, I'd really like to pass it by people if anyone's interested, is that we are doing this all on one platform. So right from your ingestion of large amounts of documents right through to the end to publishing, it's all on one platform. And we also have made it possible to do two things. The first is that the actual user will be able to comment on it. And we found that when we were doing things for policymakers in Sierra Leone, you can never really comment on like an academic paper, right? So the only way you can comment is if you cite it or something. So on this platform, you're able to comment directly and the author is able to see your comments. And another important thing is connection with the evidence as it emerges. And for that, we have done an API to Open Alex, which we also found very useful. So thank you for the opportunity to share that.
Thank you, Regina. That's great. Yeah, so well, let me just think of a question that I can make to Tamara and to Olivia. I think in a wider sense, when we're speaking about living evidence guidelines and evidence guidelines in general, we're trying to bridge, right, rigorous evidence on one side and on the other side, informed practice, right? And I'm particularly curious. I think we have, well, it's this common objective, but at the same time, Olivia seems to be working in a more specialized tool focused in maybe clinicians in dental care. And Tamara, when you presented the development evidence portal, so I've been a user of the development evidence portal. It's much wider, right? A much broader public. So I'm kind of interested in understanding how has the feedback been of usage, right? So could you tell us a little bit on how you feel? Do you receive feedback on users, and how have they been reacting to the use of living guidelines? Does this change the user experience? And to what extent do you think these guidelines are being how do they change in the user experience once they go living?
I can start with that.
Yeah, Olivia.
And I wish I could answer this question because our guidelines were just published a few weeks ago. So We're hearing positive feedback so far, but they're only a few weeks in the making, but we have plans for evaluating that in the future. Um, and we can share it with the group as that evolves, but nothing right now. But we hope that the fact that they are, we as methodologists are trying to focus on really streamlining the content that we're presenting to these clinicians to use because we've heard time and time again, we just want to know what to do. Like we just want to know what the recommendations are. So we've been really conscious in the way we've developed that infographic I was showing you before, where we're really just presenting the recommendations. It's all multi-layered. They can drill down if they want. They can find the supporting evidence if they want. But we're hoping that the ways we were thoughtful about kind of creating this infographic, that it would meet those needs that we've heard over time and time again, that we just want to know what to do. And yeah, TBD. We'll keep you posted. Thank you.
Yeah, and from my end for the DP, the team continuously conducts activities to test usability, to test, features. And so we have a survey. That's one way to collect feedback, but also there's regular trainings that we give. And we try through these trainings, be it for researchers, but also for policymakers or staff within ministries or, different types of interest holders globally. We try with these activities to collect information on usability. But also we know with funders, especially funders for AGMs, for example, evidence gap maps and others, when there's support, when they are aware of the usability, how it facilitates their work, how it helps them capture what they're looking for, it is a tool that is useful and that is needed. But yes, important to note, costly and resource intensive.
Great. Okay, I'd love to ask more questions. I think we actually, looking at the time, we should start closing. So, Christian, could we go back to our closing slides? So I'm not seeing Christian's screen, but I'm not sure. Okay, is everyone seeing it now? I can see it. Okay, great. So this is just talk about next session. We're going to talk a little bit about tools to facilitate the production and uses of living evidence, and we'll have Ian Schemilt and Caitlin Hare with us. Do we have a date for it already, Christian?
So we're trying to mute. Yeah, it's 22nd of April, but we'll send that like in the email communication to everybody.
Okay, that's great. So one more slide. In May, we're having the Covidence Alive joint session. So this is after our next one, and about what makes evidence impactful in an AI-enabled world. It's going to be a live webinar. The registration link will we post it to the chat? Yeah, there it is. So please join us if you're interested. And the Alive Learning Forum has a living evidence atlas to collect cases of living evidence. We already have a few here, as you can see. Our request is that you help us out, right, to keep this alive and to inform us. So you can do that by finding a new living evidence effort. This is you can update the status of any living evidence effort already identified and change the details. So this is an interactive map you can use. Thank you very much for joining us today. We know everyone has a busy schedule, so it was great to have you with us. Olivia and Tamara, thank you for your time as well. I learned a lot with you.
Thank you.
Thank you.